Well, hello, everybody, and welcome back to our YouTube channel. My name is Stephanie Michele Sweigart. I'm a licensed and practicing school-based speech-language pathologist out in Los Angeles, California. My pronouns are she, her, and I'm here today with SpeechTherapyPD.com. We have a special guest for you today as we sit down with Dr. Kelli Uitenham. She is the mastermind behind the course on SpeechTherapyPD.com called Functional Treatment and Tools for Aphasia. So we are excited to be able to dive into that. Get ready for an engaging and insightful conversation that we are about to have with Dr. Kelli. Dr. Kelli, thank you so much for being here today.
It's my pleasure. Thank you for having me.
Yes, absolutely. So I was excited to see in your bio, you are licensed in 9 states. How do you keep track of all of that?
Very carefully. Luckily, each state sends mail and emails to keep me up to date.
Oh my gosh, you must have an amazing organization system. Let me just tell you. And you're also the owner of Serenity Speech Therapy, which is a private telepractice. Is that right?
That's correct.
Wonderful. So what are some of the projects that you're involved in right now or that you're doing?
I'm actually working with another speech therapist who was my former professor, actually. We are working on doing some proposals for transgender voice, for the Basel Convention, and hopefully ASHA as well as what it's like to do telesupervision, and hopefully working with some universities to just share how they can provide supervision via telepractice. I'm a clinical instructor at Purdue University, and so we are actually exploring this. So I have students that come into my telepractice and actually get to provide some services by getting experience and gaining some hours. So those are some things I'm working on. I'm pretty excited about.
Those are just some things, right? No big deal.
A couple of things.
That's amazing. You're doing incredible work. Thank you for taking the time to be here with us today, because we know you're also the author of a course, multiple courses on SpeechTherapyPD.com. And we're going to talk about one today, the Functional Treatment and Tools for Aphasia. And we know this is a 2-part course where you're presenting on functional treatment exercises and activities for clients with aphasia. So what I thought we could just do in this short time together is maybe a little highlights reel. I think the golden question we really wanted to ask you would be, what would be maybe 3 quick actionable takeaways that somebody might want to know about this topic, functional treatment and tools for aphasia?
Great question. Some great functional takeaways for those who are going to be viewing the course is really going to be digging into that evidence-informed practice. We hear a lot about evidence-based, and I am a huge proponent for that, but I also like to incorporate the evidence-informed piece. So just really taking a holistic look at the client. Data is important. The numbers from standardized assessments are very important, but so are the clients, and a lot of the functional treatments and goals that we can get are actually within our client. So I really stress about talking to the client, talking to the other medical professionals that are a part of the team, as well as speaking to their caregivers. So that could be a spouse, it could be a child, an adult child. It could also be a CNA, it could be a nurse practitioner, somebody else who is laying eyes on the client, and really just incorporating all of those pieces to make sure that the therapy is fun and functional and really get the client fired up about being able to participate in speech therapy.
Wow, that is incredible. Okay, and that is what you're going to delve into in these multiple parts of this course that you have on SpeechTherapyPD.com for anybody who is listening.
Yes, so the first part is on assessment.
Okay.
And so we'll be going through the different steps and talking about standardized and non-standardized assessment tools and how important they both are. And then the second part is going to be the actual treatment and what goes on in a session for aphasia, and then looking at several case studies of the different kinds of aphasia that you may see and the different kinds of clients, and how you can have one client or 2 clients with the same diagnosis and then require completely 2 different approaches to the therapy.
Oh, I like that. It's very individualized. So, okay,
Yes.
So we have the assessment, we have the treatment, and then we have the case studies to kind of look at how there's multiple approaches that we can take when working with these clients. So real quickly, for somebody who might be listening, could you give us an example of what might be an informal assessment that you might use with this type of population?
So a non-standardized form of assessment would be interviewing either the client or the caregiver. Also doing a chart review, so going through and checking their medications, checking what other comorbidities they may have. Also during the interview process, just finding out what it is that they like. Some clients really like gardening, some really like sports, some really like cars. And I like to take those pieces of the client and their interests and then apply that to therapy so that, aphasia can be something that incorporates depression because, if you lose your ability to speak, depending upon the kind of aphasia that a client has, that can really upset a client. So if you're able to incorporate things that make them happy and get those neurons firing and getting them fired up about therapy, then it can make those sessions a lot more easier and really personalized for the client.
And as you were saying that, I had a quote in my head: neurons that fire together, wire together. So
Yes.
wishing everybody yes. This is wonderful. Thank you so much. I'm curious, if people want to find out more about you and your resources, where could they go?
Well, you can always go to my website, serenityspeechtherapy.com. That'll tell you more about the practice and the services that I offer. I also own a consulting firm called Kensington Academy. You can go there, kensingtonacademyllc.com. That is a company that I started for other SLPs who are interested in either starting their private practice or just have questions about some of the other things that I've done, like getting licensed in multiple states, getting into telepractice, possibly starting their own practice, travel therapy, which is something that I've done, pursuing their doctorate, just really a place for other SLPs who are interested and just have no idea where to start. I'm just happy to share that knowledge and help them on their speech journey as well.
Oh, wow. Okay. You are a wealth of information. Thank you for the gift that you're sharing, for your wisdom, all these little golden nuggets, and just for your support in general in our field. We do appreciate you. Thank you so much.
Pleasure.
For anybody who's listening, if you want to take a deeper dive into this topic, be sure to head over to speechtherapypd.com. Check out the course Functional Treatment and Tools for Aphasia with Dr. Kelli Uitenham. We loved having you here today. Thank you so much for coming and being a part of our journey here. For other topics, when you subscribe to speechtherapypd.com, you're going to get over 1 year access to over 900 live and on-demand courses, and you're going to scoop up those ASHA CEUs. If you found this video helpful, go ahead and give it a thumbs up. We will see you back here next week as we are answering more of those golden questions that SLPs and SLPAs are asking. We are bringing in the industry-leading experts to give you the answers. We'll see you back here next week.